All right. Welcome, everyone. I'm sure everyone is having a busy time. I know we are. I did kind of rush to get this done at the last minute just because I have been so busy. So hopefully I have not missed anything. There were a few things that I still want to try and get finished and get out to you. So I am continuing to work on things. So always working. So I will go ahead and start this presentation. Let me know if you're not. Oh, I have to share my screen first, don't I? Hold on. Okay. So now let me know if you're not seeing my screen. So as usual, we want to reserve this time for our health department staff and our school staff. So if you're not one of those two categories, please drop off the call. All of this will be available on our website, the slides and the recording within the next few days. So it will be publicly available at that time. If you have any questions, you can contact the local health department. Make sure the necessary information shared today gets trickled down to your school secretaries, principals, nurses, and whoever may need it on the front lines. I'm going to go over the data that we have available to us. I'm going to kind of start with a caveat because our data certainly is increasing. One of the rationales we follow this data is that when we see higher rates within the schools, we worry that they're contributing to increasing community transmission. If there's increasing rates in the community, we worry that that's going to lead to more transmission in the schools. So if we're seeing either one of those happening, we have to decide if we need what we need to do about it, if anything. It doesn't mean that there's a specific number where we have to take action. It just is, we just have to be watching things, but that's specifically why. We either have to look at numbers in the school because we're worried about the community, or look at the community because then we're worried about the school. So I just wanted to share a graph here that our epidemiologist made for us. This is the state as a whole. These are the weeks of the year. It's a little confusing, but so this would be the 6th week of the year. This is the 41st week of the year, which was this past week. These are the number of new cases per week. And, you know, we can see here where we first started out and then we were doing better, but we've been gradually increasing and we're getting, unfortunately, quite close to where we were in the beginning. This is very, very busy and I apologize, but this is the Central Michigan District Health Department. I have one for each district. But these are the daily cases per million. So it's kind of the rate of cases per day. This is one of the indices we've been following each week. So I plotted them for each week. Each of these points is the weekly count that we've been following since school started. The dates, I'm not really great with plotting things. So the dates are all spread out here, but it's basically each week that we've had the report come out. So these 6 counties as a whole have just gradually been increasing. You can see Clare County here has just really jumped up. We'll go over the numbers here in a minute, but it's almost completely related to a couple of nursing home or long-term care facility outbreaks. And then Isabella County, you know, this majority of this, or not majority, but a large chunk of it has been CMU. The other counties have, for the most part, been seeing a gradual increase as well. This is District 10. Again, the district as a whole has seen a steady increase.
Okay.
We've seen Wago has had some more of an increase lately. Kalkaska as well. We'll talk, Kalkaska really has not had great numbers. It's just, population-wise, they're smaller, so cases per population can seem greater. The others have pretty much followed the trend. Most of them have been increasing gradually. A couple have actually gone down recently, but again, they have relatively few numbers overall. So, a few cases here and there can make a big difference in averages. Mid-Michigan, they're extremely consistent amongst themselves, but they have just gradually gone up and up and up in those 3 counties. So just to point out that we are seeing in our counties, essentially what the state as a whole is seeing is just a gradual increase in cases. And there was fear we would see kind of the second increase. We're not really calling it a second wave or anything like that right now, but we're seeing that. I found this map. The website is here. There's a few of these different sites where they're tracking school cases around the country. You can see down here the colors. The darker the color, the more cases there are. So around the country, you can see how many school cases have occurred since school started. Michigan, really, we've had some cases, not a ton relative to some other locations in the United States. So just to kind of keep that in mind, I think we're doing a pretty good job at keeping it under control in schools. We'll look over the rest of our data here. Okay. So this might be a little bit small. I'll mail this copy out to all of you. Again, remember that at the bottom of this document when you receive it, it has all the previous dates worth of data. And down here where it says version 922 matrix, this is the matrix that we use to give us considerations of how to handle this data. So just as your reference point, this is always included with this. So you can see we have counties that are in the highest category. All of them are in the categories where you want to consider or you want to make sure that any students with symptoms have an evaluation. So just as an FYI there. Aranet County, really, they have had pretty few actual cases. It's just, again, it's a small population county. So, when they have a case every day or every other day, it adds up to be a large per population rate. There's not really a major pattern. Clare County, half of the cases that they've had over the last week have been associated with one of 2 long-term care facility outbreaks. So just to be aware of that. Now, it doesn't mean that that's not going to, affect workers there that then can affect family members, but just to be aware, it's not necessarily throughout the entire community. Half of it's within those outbreaks. Gladwin County, there's just one tiny little outbreak, but the rest seems to be just not really any pattern. Isabella, about a quarter of those cases still seem to be associated with CMU. You'll see here that this last week, the trend is actually going downward. That's what that -1 means, is that there's been a downward trend for 1 week. Osceola, there's not really been much of a pattern. Again, not a huge number of cases, just a smaller county. Roscommon, there's not been any major pattern. But again, overall, we've just been seeing more cases. You'll notice the percent positivities here have gone up. Clare County of note, their number of tests per day, or overall tests per million, I'm sorry, has really been consistent all along. It has not gone up at all. So when you have more people that are testing positive, your percent positivity is going to go up quite a bit. So just as an FYI on that. So this shows the district average has just about doubled in the last week, and positivity has gone up. I don't want to spend a ton of our time on this. I know you guys probably have questions, so we'll just focus here on some of the the big ones. Mecosta, a little over a third of the cases are associated with Ferris State. Newaygo, there really isn't a major specific pattern with Newaygo that I can pull out at this point from the past week's worth of data. Let's see where else. Misaki, they really have had a very few total number of cases, and about half of them was associated with one workplace outbreak. So there's been scattering, outbreaks associated with workplaces, with events. Mid-Michigan District, Clinton has had some scattering of some school cases. Other locations, obviously, other counties have had some school outbreaks and cases as well, but Clinton really has not had any major outbreaks or anything. They just have a variety of cases. Gratiot, about a third of their cases are related to a variety of different outbreaks that are not K through 12. They're college or workplaces. And Montcalm doesn't really seem to have much of a pattern. So at this time, we have talked at our administrative level. We had a meeting with the health departments throughout the western, central, and northern part of Michigan, because we're recognizing that we're getting past this 150 per million population, which if you think about it, that's actually a very small number of cases to have 150 people per 1 million population. But when we get to this level E here, which is sorry, I don't make you dizzy, the 150 or more cases per million, the matrix does say consider a pause. Again, that is for one of two reasons. Either the cases in the community are leading to more cases in the schools, or the cases in the schools are contributing to the high rates in the community. We feel comfortable doing what we've been doing. If there's cases in the school, we handle them. We don't feel that the school itself is what's contributing to the higher cases in the community. So we at this time don't feel, and by we, I mean we at the health department and the other health departments in Michigan that we work with and that some of your school districts cross county lines with, don't feel like we need to advise any of you at this point to switch to virtual school or make any major changes, other than to just make sure that you kind of take a step back, review what's happening, make sure everyone's complying with their preventative measures. And we recognize that a lot of people are getting just kind of burnt out on all of this. And so just kind of pull back and make sure everyone's doing everything they can. If you are finding increasing cases within the school, just sports, which we all know is not a popular decision, or you may need to think about doing some more hybrid education to decrease the population in the school. But at this point, as a health department, we don't feel we need to tell any of you, you've passed some magical threshold and it's time to go remote education. So I'm going to continue with my presentation, and then at the end, if there's questions about that, we can address them. So again, based on the community rates, if you have sick kids, we would recommend that they get tested for COVID or get an evaluation by a healthcare provider prior to returning to school. After we talked last time, a couple weeks ago, there was a new emergency order that replaced the one that was released on the 6th. So there's a new one now out that addresses the gatherings and face coverings. The link to it is here. There's a couple of infographics that help make it a little easier to understand. There's just a few changes and additions with those. It addresses libraries which my assumption would be that it would address a school library. It does not really specify that or not, but it does advise that you should have 50%. Sorry, I highlighted the wrong part here. 50% of the total occupancy in a library as allowed by the fire marshal. It does talk about recreational sports and exercise facilities. And again, it's hard for us to know, if that means like a weight room or things like that in a school. My assumption would be yes, to play it on the safe side, and that should not exceed 25% of the capacity. And those machines should be 6 feet apart from each other. If you have indoor pools, those should not exceed 25% of the maximum capacity. And if you have gatherings like sporting events or concerts, people need to be 6 feet apart from each other. So those are just additions to that order. They also added a definition for face covering, which is extremely vague. It just says that it's a covering that covers at least the nose and mouth. I just want to point that out in case you have any parent or employee that points that out. If there's any issues with that, we can try to get further clarification from the state on that. Previously, they were real specific about it being a material and that it fit around the face, and it was just a bit more specific. So I did just want to point that out. They also added this information about face coverings for childcare organizations for kids under 5. Before it just said, those under 5 didn't need to wear them. So I just wanted to point that out, that there are more specific guidelines for those age groups. They also added some information about activities. If you do have sporting events or any entertainment, which again, I'm assuming would apply to if you have concerts or anything like that, that you do need to keep track of the people that are coming into those facilities. So you have to keep a record of everyone that's coming in, including their contact information, at a minimum, their name and phone number. And so there's different ways you could do that. You could have them, fill it out on their ticket before they come in, or other things like that. But that's to facilitate contact tracing in case someone is found to be ill at that event. Guidance also came out recently from MDHHS on the 13th of October. So shortly after that epidemic order. Remember, the epidemic orders do come from MDHHS. So the view is that, these are kind of extensions of those orders. These are further guidances. So since these are all coming from the same authority, these are kind of adding to those orders. So the orders for the schools, it says you have to wear masks at all times, but this provides a little more guidance as to how bands and choirs can adjust to that. So the band requirement says that you should wear face coverings and social distance at all times. However, you can wear a slit mask while the students are playing a wind or brass instrument. This is all copy and pasted right from that guidance. We did forward it to you last week, so if you need it, still let me know. I could not find it at all on their website, so if you need a copy of it, let me know. But I did add a note here. I did put a link to an example of a slit mask that you could purchase. Not that I'm promoting it, just so you can see an example of it. But you can also make them yourself. If you get a pleated surgical style mask, it doesn't have to be an actual medical grade, but just the ones with pleats in them. You can put a straight slit under one of those pleats and it becomes a slit mask. You want all your students facing the same direction. You try to get them 6 feet apart. Vocal students, so choir, things like that. You want to have them with a face covering. Try to keep them as far apart as possible. 12 feet is preferred, but 6 is the minimum. Clean all the permanent objects between classes. Use bell covers, empty spit valves on absorbent disposable materials. Getting cold out now. Classes can be held indoors. Try to reduce the occupancy if you can and space the students, as was previously discussed. And when you can't avoid indoor practice, you should improve ventilation in the following ways. So you can open doors and windows if that's possible. If it's freezing cold out or things, that's a health risk. You can place a fan to bring in fresh air. Again, we talked before, you don't want a fan just blowing non-fresh air around. You can work on your ventilation system. You can run the HVAC system harder before and after school. You can also get just a normal HEPA filter for the room. This is a good transition into this. There is a program where you can fill out a survey about your HVAC system, and then that will be reviewed. And for those that have deficiencies or needs, you may be eligible to receive funding to help with those repairs. So it looks like the deadline for the survey is the 15th of November. The link is here. I will send this out. We'll send this out to you, and like I said, the link is going to be on this PowerPoint when we send it out to you. But if you just Google Michigan K-12 Public School HVAC Assistant Program, it should pop up. But we will send this out. So this is a nice program. It's kind of a first come, first serve program though, and we'll get it out to you. We'll also send this out as well. This link is on that program page, but it just gives you some simple steps to improve school indoor air quality. I still get this question about employees and sickness. So I'll just review it again. So when you have employees that have cough, shortness of breath, or two or more of the following, well, if they have the fever, cough, or shortness of breath, or two of the following symptoms of muscle aches, chills, sore throat, headache, vomiting, loss of taste or smell. So basically they meet those criteria for COVID symptoms. The recommendations from the CDC are that sick employees should not return until they have met the criteria for isolation. I also recently found in the OSHA guidelines, because of the limitations of current testing capabilities, employers should act cautiously on negative SARS test results. Employers should not presume that individuals who test negative for SARS-CoV-2 infection present no hazard to others in the workplace. So again, we will not say that if an employee who has symptoms of COVID tests negative, they can come back to work. If you wish to allow your staff to do that, that is something that you can make your own policy. But based on those two statements, and based on this below, which I'm down here, the false negative rates of the COVID test, we are not really going to be able to tell you, yes, it's okay to have them come back to work. Adults have been shown to be more contagious and more likely to be the source of outbreaks in schools. And so that is the rationale. Totally understand that you don't have great staffing resources for sick staff. And so again, that is something that you can choose to do. We can't really give you the go ahead on, so that is something you have to decide. So just yesterday, the CDC kind of tweaked the definition of a close contact. It's very, very similar to what it was. Previously, it was just a cumulative of 15 minutes. Now they've specified that it's cumulative over a 24-hour period. So if you're around someone who's contagious, let's say that person was working while they were symptomatic for 4 days, and you were with them 5 minutes on each of those days, that may not really add up to a close contact definition, because it wasn't within 24 hours, it was spread over 3 days. Really, that's kind of splitting hairs, but that's now officially what the CDC is saying. Other things that is pretty much the same as it used to say, it's just you had to sort of dig for it, is that really data is limited. It's hard to define a precise definition. So the whole 15 minutes and 6 feet is really not an exact science. It's just sort of a guesstimate. And you have to take in consideration proximity, duration, symptomatic, what's the environment. So all those things that we have provided for you in our toolkit and in the handouts that you can give to parents, which no one really quite seems to comprehend. It's always the 15 minutes and 6 feet seems to be what we get stuck on, but it's really a lot more to it. And then also, this pop-up window keeps popping up. Determination of close contact. For those using fabric, face coverings is not recommended. That's a little bit more gentle. It used to say that do not take into consideration face coverings. So that's just basically saying we'll consider people close contact if they meet these other criteria, whether or not they're wearing a face covering. So I just wanted to share that just so everyone knows that it's been tweaked a little bit. I know it already caused a lot of confusion, but everything's always changing. So it was brought to our attention that there might have been some misinformation shared very recently, as in the last couple of days. We get assistance in our contact tracing from the state. They have a contact tracing program. They, like the rest of us, again, are extremely busy because there are so many cases and contacts, and have recently hired numerous new contact tracers. And so I think some of their newer contact tracers are still learning the ropes. But we had found out that some close contacts were told that their whole family needed to quarantine, which we know that is not correct. That only people who are in direct contact with the case need to quarantine. Contacts of contacts do not. So if for any reason you're hearing that, we've already addressed it. We let the state know right away, and they're already dealing with it with their training program and with the new employees. So it's being corrected. But if you do have any questions come up, you can direct them to us. You can share with them this link with the CDC, where it specifically states that if you've been around someone who's a close contact, monitor your symptoms, but you do not need to quarantine. So we apologize if that's happened to any of you. But like I said, we've addressed it, and we're trying to re-educate, and we apologize. So I know that was a whirlwind. I figured we'd have a lot of questions today, so I wanted to get through that. Like I said, I am continuously trying to create some new algorithms for you and find newer resources. It's just been a slow go with other obligations. 2 other resources that just came out from MDHHS were some guidances about travel and the holidays. They're very non-specific, but I still will share them out with you when we send everything along. So I will get out of this and where'd you go? Okay, so I'll stop sharing my screen and we can get to questions.
Okay, Dr. Morris, it looks like the question says, with cases increasing, would you consider going back to weekly meetings for the schools?
If that's the wish of the group, and it's just a personal issue. I'm so busy. It's really challenged me for me to do that, but I can do that. I just might not. It just might be more questions and answers maybe on that other week rather than preparing a lot of information. But we can do that if that is the desire of the group.
So I'm wondering if maybe we need to send out a poll or a survey to this group, and I'm not sure how we make that decision, but we can talk about that, I guess.
Yeah.
Okay, next question. So I think you did touch on this, but just to make sure, Nicole Toma asks, I believe yesterday the CDC came out with new definition of close contact, and can you go over that, which you just did. Nicole, did you have any other questions?
Nope.
Oh, okay, she says no. Okay.
I was psychic.
Yeah. Next question. With the emergency order of MDHHS for face mask wearing be renewed? If I'm not mistaken, doesn't it expire on October 30?
Yeah, so Director Gordon actually has actively asked for feedback on it. And there's an email address on the bottom. So if you have feedback, you can email him. But my understanding is the plan is to renew that, and he will take into consideration any feedback or comments that they get. So, but I mean, we'll have to wait and see, but that's my understanding.
Next question. When we have fully virtual students that get COVID, do we have to record that on our website if the students are virtual?
I believe it only mentions, let me pull it up really quick. I'm pretty sure the definition of a school-related case is someone that's on the premises. So
yeah, Doc, it has to be, they would have to have been on the premises. So if they're fully virtual, but say they attended a sporting event, then yes, but otherwise, no. They have to have been on school grounds to be reported.
Yep. And honestly, most of these orders are pretty easy to understand, and they have definitions of what they mean usually they do. And so it's just, for me, it's sometimes hard for people to find them. And so if you don't know where to find them, we can go over that. But yeah, usually it pretty clearly defines what they expect from you.
Okay, the next is a statement. I think many parents do not understand what quarantine means. Might need to do a public service message on what it means to quarantine. Stay home and don't go out and about.
Yeah,
agreed.
And that's a concern I have as well, because especially our older kids, sometimes I worry quarantine might be worse in terms of disease control, because then they're all clumped together in somebody's basement hanging out together. So that is a good point. We'll brainstorm a good way to do that. I think sometimes adults are guilty of that too, a little bit, but we will think about how to best do that.
All right, next question. What if an employee leaves the country and returns with no symptoms and then has a negative test? Still no symptoms. Is that employee clear to return to work?
So if they went to a country, a level 3 country, where it's recommended that they quarantine, it'd be just like if they were exposed to somebody and they should be quarantining. A negative test does not get you out of quarantine.
Okay. Is the health department notifying schools if a student tests positive because of a contact outside of the school?
Yes, absolutely. As soon as we're aware of it. We have had some instances, whether they're students or not, where the lab might not report it to us in a timely manner, or rapid antigen testing that urgent cares might do. There's no paper record of that, and so sometimes they just tell the patient verbally. They don't send us a record of that. And so there's always times where it could just not get reported to us. But anytime we're told of a case, we'll let the school know. Anytime you find out about a student or teacher, if you haven't heard from us, you let us know, because that's a good safety measure to make sure that, you know, we just didn't accidentally not get notified too. So, but yes, we will let you know. And same with teachers. If we have a teacher that's positive, we find out is positive, we will notify you, because you'll still have close contacts you need to handle.
Okay, so the cold and flu season is coming soon. Am I correct in saying that every sickness will require a full quarantine for adult school workers?
So if they have those symptoms, the 1 major or 2 minor, that's the recommendation.
Okay. If a student has a sibling with symptoms, should the student also stay home with their sibling?
So if sibling has symptoms but has had no exposure to anyone with COVID, so they're being evaluated for COVID, and we don't have any test results, so we don't know yet, then the sibling who has no symptoms can continue to go to school. Once you know if the sick person is positive, then healthy sibling needs to stay home and quarantine. The only exception to that would be if the sick sibling was a close contact to someone and has symptoms, then they become a probable case, and then that's all different. Then we automatically start looking at close contacts and keeping them home. So we 99.9% of the time, there might be some rare exceptions, but don't have close contacts stay home until we are sure that they have been exposed to a confirmed or probable case. So while someone's being evaluated, they can keep going to school.
Okay, it looks like a same question. If a staff member has a child with symptoms, should the staff member stay home with their child for the 10 days?
If the child is diagnosed with COVID.
Okay, so if it's just symptoms, then they don't need to stay home with the child. If they're confirmed with COVID, then they would be considered a close contact and they would need to stay home.
Right.
And would that be for 14 days, not 10?
Yeah, it'd be 14 days. If they refuse to get their child tested just because they don't want to have to be in quarantine, you know, that's something you may need to discuss with your staff member or us. So that's where sometimes that's that 0.1% where we sometimes have to decide what to do with.
Okay, so looks like this person says question and answer would be great. We do, though, encourage people, if you have questions, you don't have to wait until this call to ask them. You can always email the contact at your health department, and we'll make sure to get some answers for you as quickly as possible. So just to encourage you, again, if you have questions, you can always email them to us. Next question, how do you suggest we reinforce that the protocols are not optional or adjustable? For example, there are only 3 of us in this big room, so we need masks. So we don't need masks, sorry. People seem to think they have room to determine to what extent they do or do not have to comply.
I'll just answer that. I think the best I understand the question, but part of it can be your own policies if you require masking, unless you're alone in a room, then that's what has to be done. It doesn't matter what the executive orders say if you make your policies specific and as restrictive or more restrictive than the orders. So if people are trying to nitpick the executive orders, you can make policies that are more specific as long as they're not more lenient, if that makes sense. But you have every right to make workplace policy.
Okay. Next question, I'm a food service director, K-12. Is there any new guidance on self-serve if we can do it safely, such as students taking pre-cupped fruit or bagged crackers, juice boxes, etc.? Directors from other districts have said that their local health department is now allowing self-service and that we should check with our own local health departments.
Any health department people on the call know the answer to that one?
Hey, Dr. Morris, this is Liz.
Hey.
I guess I'm on the spot. As far as I know, the state has remained silent on the issue of buffets and self-service. So in my jurisdiction, which would be Clinton, Montcalm, Gratiot, I would advise no buffets and no self-serve line.
Hey, Dr. Morris, this is Kevin. That's the same guidance that we're using in District 10.
Yeah, Dr. Morris, same for Central Michigan.
Can you repeat that again then, please, for self-serve?
So I believe, correct me if I'm wrong, you three, but the answer was no self-serve, no buffet.
Correct.
Okay. Next question. Since we are in stage E, should the sibling stay home if one family member is sick?
So if a household member is is diagnosed with COVID, whether it's confirmed or probable, all other household members should be home in quarantine. If they're just sick with who knows what, and the student is healthy, they can go to school. Not sure if that was the question or not. Again, these are recommendations. Schools can choose to have their own policies.
It kind of sounded like two different answers.
Okay, so the question was, if someone at home is sick, can the child go to school? So I wasn't sure if the question was, are they just sick we don't know what, or is the person sick with a diagnosis of COVID? So whoever asked that question can clarify.
That would be me. I'm looking at the flow chart that is on the website for District Health Department number 10. And there is a box that talks about student symptoms. And then from those symptoms, if they have a symptom, they should be excluded from school if there's any contact with potential exposure risk in the last 14 days. And under that, it says if you have a community risk level from B to E on the MyStart map, then we have to assume, and this is what our health department nurse said, that we have to assume they may have had close contact because we're in phase E in our area. And so what happened was I spoke to our health department nurse, and we had a staff member with a sick child with symptoms. In the meantime, while we are waiting for the test to come back, one district in our area allowed the other parent to return to work, while our district said, because we're in level E, they have to stay home. And so we have the same health department. And so then the other district contacted someone that said, no, they're fine, they can go back. But our nurse said that following the flow chart, because we are currently in a risk level of E, if someone has the symptoms, they should be staying home and quarantining family members.
So what that flow chart shows is what kind of evaluation that student needs. So do they have symptoms? Yes, exclude them. Were they exposed to someone with COVID? Did they travel? Or do they live in a county of, what B, C, D, or E risk level? If that is yes, then that student needs to be evaluated for COVID and or see a healthcare provider.
So does the entire family can return, like the siblings can return to school and the parents can return as school staff until that test comes back either negative or positive?
Correct.
Dr. Morse, I don't want to interrupt you, but one thing that's really helped us is something you talked to us about when we had one of our cases, and that's person A, B, and C. That's really helped us a number of times. I don't know if you need to re-explain that to the group or if you just told us that individually, but that's really helped us.
Yeah, that image, that picture, or the A, B, and C, I remember, was the contact of the contact. But I just pulled up this slide because this is talking about the use of that second box where it talks about counties where the students need evaluation. So that's just talking about there's enough COVID where that kiddo could have been exposed, so they need to be evaluated. However, like we talked earlier, until they're actually diagnosed with COVID, their household contacts can continue to go to school. So that has nothing to do with their household contacts.
And Dr. Morse, is it up to the schools to decide if they want to make their own policy that a staff member that has a child who's ill or has symptoms, they can decide to send that staff member home until they find out? I mean, it's up to the schools to make that determination if they want to make that their policy.
Well, we have had some where, the child has had really suspicious symptoms, and they felt safer having the teacher stay home, which is completely, that's fine. That's completely up to them. But in terms of using that algorithm, that is simply to help you with the disposition of a student with symptoms. It doesn't have anything to do with how to handle their close contacts. So I apologize if somebody had that a bit confused. If you want to email me and let me know what county or what person from the health department might have confused that, I can follow up with them and just make sure that they understand how to use that flow chart.
Okay, we'll move on. Many of our kids attend church and youth groups. Are churches required to wear masks?
No, they are not, unfortunately. And there's been quite a few funeral outbreaks, wedding outbreaks. But that is a little caveat was in the executive orders, and it's also in the epidemic orders that it basically says that they won't be subject to penalty. So it doesn't say they shouldn't follow it. It just says they won't be penalized.
Okay, next question. If an employee has one major or two minor symptoms and is excluded for 10 days, can the employee return with an alternate doctor diagnosis?
So if they've been out for the full isolation period, they can return. They don't need any documentation from anybody.
But they can't return early then, Dr. Morris, is what I'm hearing.
So the recommendation from the CDC and OSHA and us is that, correct? They stay out. If they had an alternate diagnosis from a healthcare provider and you feel comfortable with that, then they could return. It's just if they only have a negative test. So again, it's really tricky. I mean, you can do what you feel comfortable with. It's just, there's just not a perfect answer. And so it's hard for us to tell you, yes, it's safe to have your worker come back, because we can't really give that blessing.
Sure. No, I understand. I am trying to stay open, and had to close a couple of buildings, different points, simply because, not because I thought everybody was in danger, but because I didn't have staff.
I know. And we've had times where people were, diagnosed with strep throat, and it really ended up they had COVID, and or told they had a cold, and really ended up they had COVID. And so, even the alternate diagnosis can be wrong. So it is just really, really difficult. But I completely understand that you just aren't going to have staff. So again, you're just going to have to decide risk benefit, what you're comfortable with. And I just can't give you the blessing to say you can do this. I apologize. I can't do that.
Okay. If someone has symptoms and chooses not to go to the doctor and chooses to stay home for 10 days, is that acceptable?
Yes. Sorry, I might have said that too quietly. Yes, that is an option. If they do not get testing, if they refuse to get testing, they can stay home for the isolation period, which is the 10 days.
And again, I would think that it would be up to the school's policies on what they allow or don't allow with regard to people staying home, choosing to stay home. I mean, I'm sure that gets into a sticky area if somebody decides not to get tested and just says, I'm going to stay home for 10 days.
Well, and sometimes the testing doesn't come back until you're pretty much done with your 10 days too. So, or it's difficult to get in for testing, so.
Okay. Clarity on symptoms is confusing. Ron, did you have a question you wanted to ask on that?
It's just more of a comment. And after I typed that, Dr. Morris understandably was non-committal to navigating that officially for us. And it's related to flu symptoms. That was kind of a short comment from me. So it was more of a statement, I guess, at this point than a question.
I know. I feel bad not being able to say if A, then B, then C. But there are certain, and I think hopefully you'll appreciate that for the majority of the questions, I can give you a pretty straight answer, but there's just certain things where there's just enough gray zone. It's hard to give a good answer.
I totally respect you on that. That's all.
Okay. With the symptoms we use for screening for the adults and the students, we have shortened it so that it's not every single possible symptom. So hopefully it makes it a little easier, but I know none of this is easy.
Okay, we'll move on to next question. What should we do if a student reports that they have had positive COVID test, but we have not received any sort of confirmation from the health department?
You call us and we try to figure it out. And again, we know that has happened. One of the biggest culprits is that rapid antigen testing. So one big help to us, and I know this is just asking you to do one more thing, but if they tell you that they are positive and you're like, oh, well, that's news to me. If you can ask them, where did you get tested? Because then it helps us to try to track it down, because a lot of times, again, it's just some urgent care that we have to try to call and get the results. We have had times where we end up tracking it down and it actually was not positive. So we really do like to have confirmation that it is truly positive before we start, having you pull kids from school, and then having to tell them later, well, wait a minute, this was wrong. So if you can ask them, okay, where were you tested? What day were you tested? And then call us, and then we will, because we have the authority to get those results, we will track them down and then educate that provider that they have to by law report those results to us. So I actually just had a conversation about this with one of my nurses yesterday because that was happening. So yeah, any feedback you can give us when those things happen, we can work on fixing it. So again, when we find out, we'll call you. If you find out, you call us. And between the two of us, hopefully we won't miss anything.
Okay, Stacy says, I thought isolation was 14 days.
So I know the nomenclature is a big pain in the keister. So if you were exposed but not sick or infected, you go into quarantine, which is 14 days past the last day you were exposed. If you are infected with COVID, you go into isolation, which is 10 days and 24 hours fever-free and symptoms improved. So it's nomenclature. Quarantine is 14 days, isolation is 10 days. I know it's, again, we have to make it as confusing as possible for you guys, just so your life is more interesting, I guess. It's not fun. I know, it's just stupid.
Okay. John asks, during the course of this call, covidactnow.org has placed Clinton County in the highest risk category with just over 25 cases per 100,000. This is as of October 21 on michigan.gov/coronavirus. This increase is not being reported. Do you think we will see this spike in Clinton in the next few days?
Well, let me pull it up on the MyStart, right? And that's the issue, is every time I go to the MyStart map, something changes. And the COVID Act now, I don't know where they get their numbers from. So, and they follow it per 100,000. We follow it per million, which again is, I think, interesting. So right now, the MyStart map info has our confirmed and probable cases for Clinton County over the last 7 days averaged at 143 per million. Well, if I hover over it, actually, today, the 19th, because that's the most recent they have data for, it was at 155.9. So that is in the highest category for us as well. So, but as I showed you earlier, we have several counties that are in that highest category at this time. In fact, we have some that are over 200. So, but remember, that's 200 people per 1 million people. I can't remember what he said the other one was per 100,000. But yes, we're seeing big increases. So whatever you can do to help convince your community members to wear their masks, to not have parties, to not congregate in groups as much will really help us to be able to keep school going in person and to keep school cases from occurring.
Well, that was the last question in the chat box. Does anybody else have any questions you'd like to either add to the chat or unmute yourself and ask directly? Pretty quiet, Dr. Morse.
I think I depressed everybody.
No way. Okay.
Thank you.
Thank you
Lots
all.
of thank yous. Go State.
Yeah, go State, Tony there. But thank you all for all your hard work. We know that this is really, really difficult. Again, we feel comfortable keeping in-person education as long as the schools are doing well. We know it's really challenging when you do have cases in the school. There's a lot of contact tracing that goes on. Let us know if you're having concerns with your parents, if you're hearing things, if you need to hear from us, if we need to help with messaging, whatever it is. But we feel comfortable, again, that the schools are contributing to the community rates and that the community rates aren't really, causing huge risks to the schools. So we're going to stay the course. I'll continue to try to work on additional resources as I have time. We'll discuss having meetings every week, even if just the off weeks are more for just Q&A. We'll figure out a way to gauge that. So, all right. Otherwise, if there's no other questions, we'll sign off.
Okay, thank you, everybody.